Teachers get more respect than anyone else.
Yes, sir. Teaching is a very noble profession, and you have compiled nobility in every sector, in everything that you're doing in life.
Imparting knowledge, what you have gained over the years.
Dentistry is not merely about fillings or extractions. It's about building a nation with dazzling smiles where the overall quality of life is also improved. Hi, I'm Dr. Richita, and today we are shedding the light on a vital aspect of public health. Yes, that is public health dentistry. So before diving deep into this subject, I would like to take a moment to thank Cuspyd, who has been a trusted partner for all you NEET MDS aspirants. Cuspyd is an evolving edutech company which is truly working in transforming the way in which dental professionals learn and grow. So in today's episode, we have our special guest, Dr. L. Vamshi Krishna, sir. So, sir is the Secretary of Indian Association of Public Health Dentistry and Academic Council member and the Board of Studies member for various universities. Sir is also the principal of Anil Neerukonda Institution of Dental Sciences, where he's the professor and the head of the Department of Public Health Dentistry. Sir is also the core committee member for the development, validation, and implementation of training manual for dental professionals under the National Resource Center of Oral Health and Tobacco Cessation, New Delhi, Ministry of Health and Family Welfare. So welcome to the show, sir.
Thank you. Thanks you for inviting Cuspyd.
Sir, so we are really excited to know more about this branch of public health dentistry. And I'm sure you have lots of knowledge for all the students who are watching this video. So, sir, we would start by knowing how has your journey in public health so far and how is it going for you?
I was doing my internship in Government Dental College, Bangalore, way back in 2001. As an undergraduate student, what I studied, the theoretical aspect, and when I started doing my internship in GDC Bangalore, I met fantastic teachers and postgraduate students. That is the first place in India where public health dentistry post-graduation has started.
Okay, sir.
So I started interacting with PGs and I have seen the field work they were doing and the kind of oral health disease burden estimation they are doing, and how this is going to be useful for the governments to make the policy. That inspired me to join public health dentistry. And since then, there was only plan A for me. There is no alternative plan B to join public health dentistry at any cost. And I did join public health dentistry, and I never looked back, and it carried forward. Still, now I'm teaching the subject from past 17 years.
That's great, sir. So you are absolutely destined to be in public health dentistry, and I'm sure the branch is really lucky to have you as a part of it. So, sir, one more thing that I have a doubt that if I talk about from the perspective of a BD student, so public health dentistry has a broader aspect. So it's about reaching to each and every person in the whole public population. So if I want to choose this branch, should I have this specific orientation towards service or public health? So can I join it only if I have this kind of agenda in my mind, or anyone can join it?
No, anyone can join it. There is no particular agenda or you fix that I need to go to the people all the time and work on it. It is one of the component or one of the aspects in public health dentistry where you will be going into the fields and working. Yes. I can definitely recommend any NEET aspirant to choose, though it doesn't have this quality of going and not that outspoken or not having the skills or thought process of going and meeting people and community at large. Still, they can definitely take the specialty.
Okay, yeah. They develop it.
They develop. The moment you join the program, you will develop the interest, you will develop the leadership skills and going into the people. That is only one particular aspect of the field-based activities where we'll be doing the program, we'll be doing the orientation about the rural dynamics, urban dynamics. So people will get acquainted very soon. So they should not have any definitive skills or thoughts to per se join the specialty.
Okay.
Yes, anyone can opt for it.
So that really sums it up that anyone can join it. You don't need to have a specific orientation towards a specific agenda. And that's what PG life is all about. You will learn things. So coming to another question, which I'm sure any NEET MDS aspirant would like to ask you is, if they're choosing this branch, what all is taught in the curriculum in first, second and third year of MDS?
See, per se, as per the curriculum, it remains the same for all the specialities. Doing the library dissertation, thesis, the term paper, the research work, XYZ. In specific to public health dentistry, so they will be introduced to planning and evaluation, research design, study designs, in depth about epidemiology, clinical trials, and policy making, and about making or preparing or doing the background work for national oral health policy and how to take it forward. And the training program from first year, second year, third year, gradually it starts with public health. It goes more into depth into the dental public health and more into the research orientation. And along with that, a lot of preventive care and how to do oral health promotion and estimation of disease burden is the core area over here, and how you turn your field work into mathematical proportions, which you present in front of the agencies so that they can develop a policy to treat and give a better oral health.
Yes, sir. So basically, you people are putting in a lot of effort so that the whole humanity will be benefited by it. So I see a lot of science and math going in there.
Yes.
So public health dentistry used to scare me when even I was a BD student. I could never understand statistics and how to do studies and all these tests, T-test and ANOVA and all that. So I'm sure any student who's apprehensive about it, they'll be able to learn it in this course as it goes.
Exactly.
Sir, as you are an empaneled national trainer for oral care under the NHRC, Ayushman Bharat, Health and Wellness Center in National Health Mission. So, sir, I am interested in the importance of any oral healthcare camps and various types that are conducted in colleges and also what you can do in private practice.
Yeah.
So, can you just provide us with more
Per
information?
se, when you are pursuing your post-graduation program or undergraduation program, under public health dentistry, there are a lot of outreach activities. These outreach activities basically are more focused towards reaching the unreached.
Yes, sir.
So there are school-based dental health outreach programs. There are specific populations like underserved population or ignored population or population at risk, like the geriatric population and differentially able children, and areas where they are prone to exposure to certain chemicals or the factories or occupational, those areas, specific areas we look for to conduct the outreach activities. And wherever there is need for oral care, where there is no reach for the community people to, where there is improper distribution of the dentists, especially in the rural area, we try to reach there and do it. When it comes to the private dental practice, it is creating awareness among the communities in that area about availability of the dentist and availability of the oral health care services. And when you do a oral health screenings, simultaneously you are educating them about what is going wrong with their oral health and how they can improvise the oral health.
Okay. So this is basically giving broader service to the people around your area when it comes to private practice.
Yes, and reaching
the masses. Yes. So coming to the scope of public health dentistry, what would you like to tell us about the scope in India and abroad? What all job opportunities are there?
Yes. Initially, when public health dentistry started in India and post-graduation program started in very few colleges, when I was doing my post-graduation, there was very, very few colleges in India which were where there was MDS program in public health dentistry. So about 20 to 23 students used to pass out at that time. This was in 2003, 2006. And at that time, there were a lot of job opportunities in academics. So anyone who joins public health dentistry, they used to get a job immediately in a dental college. So gradually the number of uh, people pursuing public health dentistry increased, number of colleges starting MDS in public health dentistry increased, and that academic job gap was subsequently started filling. And the post-graduation program, the number of teaching faculty required was also increasing. Right. Still, there is an abundant demand of teaching faculty in dental colleges. So that is one component, one portion. So as a public health dentist, as Secretary of Indian Association of Public, and part of the postgraduate training program from many years, so I might take a message or my recommendation for the NEET aspirants who want to pursue public health dentistry. Joining academics is one part. And public health dentistry has many competencies. Yes. Public health dentist, during the post-graduation program, at the end of the course, you will be an epidemiologist. You will be a health informatician. You will be a policy developer. You are a big data manager. You are a research analyst. You are a biostatistician. There are so many wide areas opened up. So, and healthcare has boomed, especially due to the corporate intervention. It has become a big sector. There are big companies across the globe and in India who are recruiting public health dentists on a large scale. You'll be surprised with the kind of packages they get. They are hired under as a health informatician, as an epidemiologist, and a research analyst, and big data manager, as a biostatistician. And they are also part of study designs. So this is a big sector where we are tapping on. And most of our postgraduates recently who are passed in last 2-3 years, they are employed in big MNCs in India. But they are into companies like Quintiles, Paraxel, GSK, and many life sciences companies across India who are working for US-based and European clients. Whereas in academics, yeah, there are opportunities, but growth, it takes a little time.
Okay, sir. Sir, I'm sure your PG students are super lucky to be under you. And the answer that you gave definitely opened my eyes regarding the scope and opportunities that you have after choosing this branch. So that's really amazing to know.
This is only in the private sector. When
Yes.
it comes to government sector, most of the state nodal officers of National Oral Health Program and National Health Mission, public health dentist is preferred.
Yes, sir.
By the governments, because they understand the dynamics of the population very well, and it will be helpful for the governments to recruit them. And one more important aspect during the training of post-graduation in public health dentistry is tobacco cessation centers.
Yes, sir.
This is all governments across the globe are fighting this tobacco a lot, and there is a lot of money that is spent on eradicating the use of the tobacco or stopping the use of the tobacco or preventing the use of the tobacco in various forms.
Yes.
So the public health dentists are trained in extensively in as an expert counselor. So, and there is so many recruitment opportunities in this particular sector where there is a oral health counselor and you are a consultant for many of the NGOs and government sectors.
Okay, sir. Yes, sir. I agree to that. Obviously, a public health dentist would be the right person for tobacco cessation counseling because they would know the best. So, sir, thank you so much. You've told us so much about this branch, and I'm sure it broadened all the horizons for so many BDS students out there who are aspiring to choose MDS. And if you are choosing public health dentistry, I'm sure now you must have gotten a greater idea about what this branch is all about and so many opportunities which are lying ahead for you. So, sir, this was all technical questions about the branch, and studies related. So, we would like to know you better as a person. Okay. So, I have some fun questions lined up for you. Okay. So, are you ready for it?
Yes.
Okay. So, this is like a small game. In this, you have to give me one word for one word which I am speaking. Okay. So, the first word is statistics in studies. What do you think about it? Anything that pops in your mind?
Math.
Maths. lot of math
Yes.
involved in there.
Yes.
Okay, so
It doesn't mean I'm scaring the aspirants of public health dentists that you need to be good in math.
okay.
It's a simple math, and we have a lot of digital softwares which help you very easily. The only thing you need to know which test to be used when.
Yes, sir. Yes, so nowadays technology is helping so much in that. Okay, so coming to the second part, what about screening camps or treatment camps?
Both. Just do screening and we cannot leave. You have to definitely treat people.
Yes, sir. So prevention or treatment?
Prevention. Anytime.
Yes, coming from a public health
Yes.
dentist.
That cuts down the exchequers, a lot of expenditure
Yes,
if you are
sir.
doing prevention. Yes.
Also a lot of trauma to the patient in the
Exactly.
long run.
Yes.
Sir, teaching or treating patients?
When it comes to me,
Yes, sir.
teaching,
Okay, sir. So the academician in you is definitely speaking out here. So can you tell us one thing that you really love about your job?
I enjoy teaching. My students are there across the globe. I'm very connected to people. Teachers get more respect than anyone else.
Yes, sir. Teaching is a very noble profession, and you have compiled nobility in every sector, in everything that you're doing in life.
Imparting knowledge, what you have gained over the years, along with the experience, it definitely gives a very good satisfaction at the end of the day.
I agree to that. So guys, that wraps up this session, and we are really, really thankful to sir who took out his precious time and came here and imparted all that knowledge for you all. So sir, we have a small gesture of our gratitude for you.
Thank you so
So,
much for
thank you
having
so-
me on the show.
Thank you so much for coming here, sir.